Okay, so the topic this evening is glutathione and gastrointestinal health. Um, I'll start right at the very top of the alimentary system. I will say gastrointestinal health, and it starts at the stomach, because and then goes down. But above the stomach, there's the esophagus, and above the esophagus, there's the oral cavity. So let's start right from the beginning. And even in the mouth, in the saliva, you can see that glutathione has a role. Glutathione is an important redox regulator. The redox is reduction oxidation balance in saliva, and its maintenance is essential for periodontal health. That's your teeth and your gums. And periodontitis, there's inflammation of the gums that protect the teeth. And in those patients, it has been found that they have reduced total antioxidant capacity. It's insufficient to fight all the free radicals that attack the tissues there. And studies have shown that boosting glutathione may help improve periodontal health, and high levels of glutathione may protect against oral cancer. Okay, so this what are in the journals. So from the oral cavity, we move down to the esophagus. And of interest here is GERD, gastroesophageal reflux disorder or disease. And we look at the anatomy. So you know that the stomach is full of acid. And the stomach mucosa, or the lining of the stomach, is such that it can withstand the very high acidity that is required to digest the food. But it is not so for the esophagus, which means the acid is not supposed to go upward. So you can see in the diagram on the right, the stuff is supposed to be the acid. So in the reflux disease or disorder, it already goes up the esophagus, and the higher it goes up, the more severe it is. There is a sphincter at the lower end there that's supposed to prevent that, but for many of us, that sphincter is not working as well as it should anymore, and many people, in fact, suffer from some degree of reflux. Okay, so what are the GERD symptoms? And these symptoms are related to the reflux, and some symptoms are associated with the damage to esophagus. You know, if the reflux is chronic, then slowly there will be damage. You may have chest pain or heartburn, difficulty in swallowing food, difficulty to sleep due to heartburn, constant sore throat, unintentional weight loss, blood in stool. When you have blood and weight loss, that means already severe damage. You know, sometimes you get woken up with a severe pain in the throat because the acid has got up there, right? When the acid just goes up to the esophagus, the discomfort is not as bad. So when the acid actually reaches your throat and your mouth, because the tissues, they are totally not supposed to face the acid, because in fact your saliva is alkaline. So the oral cavity is supposed to face an alkaline environment. So when the acid comes up, you know, there's a severe disruption in the pH that causes so much pain for those who have reflux and the acid reaches the mouth. Okay. And then, so this reflux if chronic, then can cause changes. And the first noticeable change will be what is called Barrett's esophagus. This is a condition in which the normal stratified squamous epithelium, which is the normal pink mucosal lining of the esophagus, is damaged by the acid reflux, and it becomes thickens and reddens. And this, of course, can only be seen when you do an endoscopy. And then if you do biopsy, then you can confirm the changes there and whether there are already changes that will progress to cancer one day. Okay. So there is metaplasia or dysplasia, which is changes that that you have to look for, which could be the earliest changes towards cancer. So this condition, Barrett's esophagus, is considered as a pre-malignant condition, where its prevalence is estimated at 1.5% in the general population and 15% in those with gut disease, right? With known gut disease. So that's very high, 15% having this condition. This condition, Barrett's esophagus, is asymptomatic, right? So the thickening and the reddening does not cause symptoms, but the person suffering on it, suffering of it, may have the symptoms of the reflux and acid, heartburn, and the other symptoms that have been mentioned earlier on. As mentioned, this is only confirmed by endoscopy. However, regular checkups with thorough imaging and extensive biopsies of the esophagus to screen for precancerous cells are crucial, as Barrett's esophagus raises the chance of developing esophageal cancer. Okay, because it is pre-malignant or precancerous, once it is confirmed, you must have regular check. Okay, one of my close friends, cardiologist at Tawakal Hospital, died of esophageal cancer. Actually, died probably of the surgery to remove the cancer. Yeah, barely 1 month after diagnosis. So many people don't suspect, but if your condition is diagnosed at this stage, Barrett's esophagus, then you have a much better chance of avoiding the cancer with regular biopsy and treatment. And even if treatment is necessary, if it's cancer developed, the earlier the detection, the earlier the intervention, the better is the result. So this is the endoscopic view of the lower esophagus in a normal case and in the Barrett's esophagus. You can see there's the darkening and totally different nature of the mucosal lining. So what's the role of glutathione? Acid reflux upwards into the esophagus causes oxidative stress, inflammation, damage, and pain. Oxidative stress has an important role in the pathogenesis of GERD, and if chronic, then it develops into Barrett's esophagus, which is precancerous, as mentioned earlier. And studies show that glutathione is depleted in the esophagus of GERD sufferers. And boosting glutathione may expedite healing. More importantly, making sure that you have high glutathione may prevent the development of Barrett's esophagus. And if you prevent Barrett's esophagus, then you will prevent the esophageal cancer. All right, what about the rest of the GI tract? The primary role of glutathione is to protect cells from oxidative stress. It is also anti-inflammatory. It is also crucial for the detoxification and immune functions of the GIT. Glutathione is abundantly distributed in the mucosal cells of the GIT tract. The highest concentration is found in the duodenum, right? That's the first part after the stomach. Okay. If you take glutathione orally, and you know that it is poorly absorbed, but still whatever is absorbed, most of it is absorbed in the upper jejunum, all right? So after the duodenum, you have the jejunum, is the upper part of the jejunum. This is the small intestines. Okay. But as we all know, glutathione taken orally is poorly absorbed because most of it is hydrolyzed, right? It's just say that it is digested. The detoxifying capability of glutathione is directly related to its thiol group, the SH group, remember? If you just remember the previous lectures, and to its functions as a substrate for enzymatic activity, right? So glutathione works with a host of glutathione enzymes. And in fact, glutathione regulates the action of these enzymes, right? Example, the glutathione peroxidases and the glutathione transferases, right? So these are the enzymes that work with glutathione in fighting the free radicals and protecting our proteins from damage. So there is a direct relation between glutathione concentration and the gut mucosal damage, right? So studies have shown the higher the concentration of glutathione you have in the mucosa, the less damage there is. Sorry. There is also a direct relation between glutathione-related enzymes and the various pathological conditions, including cancers, of the GIT, of the gastrointestinal tract, right? Starting from the esophagus to the rectum. Now we can also add, starting from the, the oral cavity itself, because glutathione is very important protector of the health of the oral cavity. So these enzymes are stimulated by a high intake of vegetables and fruits. So one more reason to take plenty of fruits and veggies. Healthy level of glutathione is needed to maintain a normal antioxidant potential in the mucosal cells of the GI tract to maintain health and avoid diseases which are associated with having low glutathione. Age, gender, drugs, and alcohol consumption affect glutathione concentration. Right? Age, the older you are, the lower is your glutathione. Gender, men have lower glutathione levels than women. Possibly one of the reasons why women live longer. Okay, but many drugs lower glutathione, and of course, alcohol consumption also lower glutathione and cause a lot of damage in the esophagus, in the stomach, and the liver, pancreas, and many other organs. Okay. The gut plays a very, very big role in our overall immunity. It is estimated that 60 to 90% of our defense against infections and toxins occurs in the intestines. Right? And this is very important. That's the first barrier, because if the germs and toxins are neutralized in the gut, then they don't have access into the body proper, and therefore all the other organs are protected. Okay, just imagine that our gastrointestinal tract is just like a pipe running in the middle of the body. It is in some ways, it is not part of the body, but in many ways it is part of the body. Glutathione empowers the immune cells lining the gut and detoxifies toxins. Okay, and we know as we know a lot more about the health of the gut, we also know the role of the friendly bacteria or the microbiome, and And this microbiome, they are living organisms, they have DNA, and because there are more of this friendly bacteria than we have cells, so there's more foreign or other DNA than the DNA that belong to us, that came from our parents. But actually, we have to treat all those DNA of the microbiome as part of us now. Those bacteria that's inside of us, they are part of us. That they are living in symbiosis with us. And as mentioned in the beginning by Joel, there is the gut brain axis, and a lot of the things that happen in the gut influences not only our health, but also our behavior and our emotions. Okay, you talk about gut feeling. So now you have a better understanding gut feeling. The bacteria is influencing you also. As we talk about the various diseases of the stomach, you start with healthy stomach. And many of us have this bacteria called Helicobacter pylori, or H. pylori for short. And it is the number one cause of stomach inflammation, leading to gastritis. And from gastritis, if not stopped, then you start having erosion. That means the lining becomes damaged. Okay. And then if not stopped and gets worse, then you have ulcers. That means there is now a hole. And if you're not lucky, it can perforate. Yeah. In my younger days as a doctor, I remember operating on perforated stomachs because of ulcers. Okay. And finally, this H. pylori is known to cause stomach cancer. So several studies have shown that oxidative damage contributes to gastritis and gastric ulcers. This damage is counteracted by various antioxidants, including glutathione, which may help defend the gastric mucosa. H. pylori infection causes depletion of gastric mucosal glutathione, and then also causes inflammation, which is the gastritis, and hyperproliferation of gastric mucosa. That means the gastric mucosa, in response to the H. pylori infection, then will be growing too fast. Boosting glutathione, studies have shown, resulted in inflammation and epithelial proliferation levels returning to baseline levels. That means boosting glutathione can reverse those changes caused by H. pylori infection. This indicates that glutathione supplementation may help in reducing tissue damage caused by H. pylori infection. But until now, as far as I'm aware, it is not standard treatment, right? They give antacids, they give antibiotics, but they don't think, right? The doctors don't think about boosting glutathione. But studies have shown this should be the case. Okay, so glutathione should be considered as a supportive therapy during H. pylori eradication therapy, but the doctors are slow to catch up because this is not a drug. Nobody is promoting to the doctors, so the doctor don't know. Hopefully, if you have gastric problem, gastritis, erosion, ulcer, then make sure you have plenty of glutathione. And don't forget, H. pylori infection is precancerous, right? Just as the Barrett's esophagus is precancerous, H. pylori infection, once you have it confirmed, you're considered to have a precancerous condition. So let's look at the level of glutathione and gastric mucosa. Now, For a long, long time, we have been told that the highest level of glutathione is in the liver, right? Well, actually, the highest level of glutathione is in the gastric mucosa. The total glutathione content of normal gastric mucosa was significantly higher than that of human liver biopsy specimens. Something new. Okay, it's not surprising because you know how strong is the stomach acid. Yeah, if you know how strong the stomach acid, then you won't be surprised that what's protecting the stomach mucosal cells is glutathione, and the levels necessary is much, much, much higher than even in the liver. But on the other hand, when they studied the gastric cancer tissue, they found significantly lower concentrations of total glutathione. Okay, so it's either being used up in trying to fight the cancer, or the low levels, for whatever reason, promotes the cancer and causes the cancer. What about the colon? We know that the bulk of gut microbiome is in the colon, and glutathione plays a significant role in maintaining healthy microbiome, healthy colon, and healthy overall health. Glutathione protects the colon from oxidative stress and inflammation and modulates autoimmunity. These are the major factors in inflammatory bowel diseases, IBD, which include ulcerative colitis and Crohn's disease. Thus, glutathione may help manage these diseases. Studies show decreased activity of key enzymes involved in glutathione synthesis, and this contributes to the mucosal glutathione deficiency in IBD, meaning a possible contributing factor to why in these conditions they have low glutathione is a defect in the enzyme system, that they don't have enough enzymes. And remember, if you remember my talks on autism, right? In autism, many are found to have defective genes involved in glutathione synthesis. So it may be possible that one day they will also discover that there are defective genes involved in glutathione synthesis in people with IBD. And then we go to IBS, or irritable bowel syndrome. And this is associated also with oxidative stress and abnormal inflammatory response, and also with low glutathione and low glutathione reductase. Glutathione reductase is the enzyme necessary to recycle, to recharge the oxidized glutathione back to the reduced form of glutathione. So when you have low levels of glutathione reductase, then there is poor ability to recycle or recharge GSSG to GSH. So you may have to replenish your glutathione, your active glutathione, by supplementing with glutathione boosters, right? You have to boost up production because your recycling ability is poor, right? These are what are discovered in some of those with irritable bowel syndrome. So you can see in the colon, then glutathione plays a significant role in maintaining a healthy microbiome, and the science of microbiome, is when it's growing by leaps and bounds, because more and more discovered, not only in terms of having influence on our overall health, but also having influence on our brain and our thinking, and even our genome. All right, our overall genome, because as mentioned earlier on, there are more DNA of this microbiome than our own original DNA. Okay, so combined together, So you and I, each one of us as an organism includes our cells and the cells of the microbiome. And that's our total DNA. Okay. And then we know that glutathione has a significant role in inflammatory bowel diseases. And these diseases are very difficult to correct. I think part of the reason is because the doctors are not using glutathione, or those who are using are not using enough. It is not part of the standard treatment, right? Even though studies have shown that glutathione um, should be able to play a big role because oxidative stress, inflammation, and autoimmunity are all major factors. And in IBS, irritable bowel syndrome, is a disease that, with a big question mark, until now, there's a lot of uncertainty on what is the cause, although more and more studies are coming in. It is understood as a functional, meaning there's no physical problem, but only a functional problem. But that's not 100% true. Now studies have shown that oxidative stress and inflammation do play a part. And then after discovering that IBS is associated with having low glutathione and low glutathione reductase, then that it's not just a simple functional issue. It is becoming better understood, just like many other diseases. When we discover the underlying abnormalities, then we are able to treat. So hopefully, with the discovery that glutathione plays an important role in IBS, and the doctors should be also using glutathione as part of the management, and hopefully will help many people. Okay. The last thing is the cancers. We start with oral cancer, glutathione, low glutathione, which is associated with increased oral cancer. We know that esophageal cancer is part of the risk of GERD. Okay. And that Barrett's esophagus is a precancerous condition, and the cancer is esophageal cancer. Then stomach cancer is related to H. pylori and depletion of glutathione, because glutathione is the main protector of the mucosal cells, right? And then when you go down to the colon, also the same thing. Glutathione is a major protector of the colon and maintaining the general health of the colon and the microbiome. So likewise, even in colorectal cancer, glutathione has a role in reducing the risk. Even though once the cancer is established, as I mentioned many times, then the role of glutathione is a bit controversial and confusing also. Okay. Then we go to the leaky gut syndrome. The lining of our gut is an important barrier to protect the body from harmful toxins, bacteria, and particles that can leak into the bloodstream. Leaky gut occurs once this lining and barrier is compromised. This can cause a myriad of autoimmune symptoms and gut disorders such as dysbiosis. Dysbiosis means an unhealthy balance of the microbiome. Glutathione in the cells lining the intestines helps to heal and regenerate these cells and restore an intact barrier. So very important to have sufficient glutathione to help prevent this condition. So maintaining a healthy level of glutathione can help prevent leaky gut syndrome. In severe cases of leaky gut syndromes, right, doctors have used IV glutathione for repair, right? Because you really need very high levels, which is not achievable through glutathione precursor supplementation. Okay, finally, we must touch on the microbiome itself. So gut microbiome is very important in maintaining gut health and overall health. Glutathione in the intestinal lining maintains healthy cells, which in turn helps sustain healthy microbiome. Interestingly, healthy microbiome also helps in glutathione production. Okay? And in fact, there are probiotic bacteria that synthesize glutathione. And if you have them in your bowel, then they help increase the glutathione supply in the gut, right? Which may be needed by the other bacteria, the microbiome, that do not produce glutathione. So conclusion. So I take this statement from one of the review papers, and the author state that it is difficult to overstate the importance of glutathione because it performs many critical biological functions. And by now you all know there's so many functions. Nothing escapes the need for glutathione in our body, right? Really, literally from the head to the toe. Because of that, one of the most important proactive steps people can take to improve their health and slow down the onset of age-related diseases is to boost their glutathione. The GI tract, like all the other organ systems, benefits tremendously from having healthy levels of glutathione, including preventing and healing diseases of the esophagus, stomach, small intestines, colon, and rectum. You can even add the mouth. Okay, thank you very much.